Union Health Secretary Rajesh Bhushan is also set to hold a meeting via video conferencing with the state's health secretaries and senior officers to review COVID-19 preparedness today evening. A nationwide mock drill is also being planned for 10th to 11th April, wherein health facilities from all districts are expected to participate. Details of the mock drill will be communicated in the meeting today. Joining us on the broadcast now is Dr. Ishwar Gilara. Dr. Ishwar Gilara, of course, is a health expert. Thank you so much, Dr. Gilara, for speaking with us. Sir, we're conducting mock drills in order to avoid what had happened during the second wave of the pandemic. So the question that I have for you is, do you think that these mock drills, from what you've seen of them, are going to be successful this time around?
No, Paridhi, thank you very much for having me on this show. Even the risk is minimal, the preparedness should be maximal. That is the principle one should work, and there should be a pan year around preparedness. Preparedness should not disturb common people. Preparedness should be among those healthcare workers or the authorities which are involved in that. Similarly, the genome sequencing, etc., should be laboratory work, and it should not go to people. What is happening currently is whatever is happening in the lab is going to the people within an hour, and people get panic, and people start talking about new wave coming. I just read that is the fifth wave coming in India. I do not know when was the fourth wave. We never had a fourth wave. So a lot of headlines are being talked about. Yes, there is a new subvariant which has come, which is XBB.1.16, and that is from the USA. And currently, almost 15 to 20% of the cases are this new variant. But this subvariant or new variant or subvariant is of Omicron only. And so long as Omicron is not replaced by another variant, which is more powerful or equal to Delta, we should not be worried at all. What we should be doing is currently, number one, reverse masking. Those people who have some kind of symptom like runny nose or cough, even once, they should wear the mask. Those people which are with comorbidity or aged above 60, they should wear mask. They should be vaccinated, because our third dose of vaccination has been only uptake by 29 to 30% people. People have not taken the third dose. And those who have taken the second dose, almost 2 years are passed after the second dose. So under this situation, what is required is something which is in our hand, which we are not doing, and then we keep on blaming the government and the authorities. What is in our hand is, if you have not taken the third dose, please take it. Number two, if you have little symptom, protect yourself. Number three, not only protect yourself, you should protect your elderly at home, which are with a comorbidities, 60 plus people, uncontrolled diabetes, renal problem, bronchial asthma, tuberculosis patient, and by that way we can prevent. But so long as this XBB is a part of the recombinant of BA.2, which is Omicron BA.2. In India, since beginning of Omicron, it is only BA.2. Our BA.2 is such a good variant. I call it always a variant of support. It did not allow BA.4 or 5 to come in India. And therefore, it has not harmed us at all. Okay, the cases are going up. Currently, we are seeing almost 10 times more cases than what it was in 1 month before. So we should be cautious. We should be prepared, and hospitals should be prepared. So long as the oxygen demand or ICU demand or ventilator demand is not high, so long as deaths are not rising, we have compared the deaths last week and this week, it is 24 or 25 per week only. So deaths, we do not want even those 25 people to die per week. But those people who are dying, they are with comorbidities. So we should look after comorbidities. We should look after elderly people. We should be prepared. And that's what is being done. And I was with Rajesh Bhushan, the health secretary, 2 days before in Varanasi, but that was in another context. And we did not discuss COVID at all that time.
All right, Dr. Gilara, so we're running out of time, and I'm just going to ask you a very, very short question before we let you go, sir. COVID cases have been on the rise in the last couple of weeks. Is that something that should be worrying us?
One should understand one thing. These kind of variants, subvariants will keep on coming. COVID has not gone away. It will stay with us just like any other flu. So this kind of little bit surges will be there. What we should be always bothered about, is it more vicious than the previous variant or subvariant? If it is not, we should not be bothered about. What we should be bothered about is how we should be prepared and what kind of precautions are required, and is only this virus is going to go out or come in from nose and mouth. So cover that area. You don't need to cover the whole world.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.